Hello, dear colleagues. I'm glad to present here results of our research understanding the relationship between the Russian war in Ukraine and COVID-19 spread in Canada using machine learning techniques. This research was made in collaboration of National Aerospace University, Kharkiv Aviation Institute, and University of Waterloo in Canada. So the COVID-19 pandemic is a complex global health crisis caused by the severe acute respiratory syndrome coronavirus 2 virus, which has rapidly spread across the globe, resulting in significant morbidity, mortality, and social and economical disruptions. This pandemic has highlighted the vulnerability of healthcare systems worldwide. It has challenged healthcare professionals and researchers' capacity to implement effective measures to control the transmission of the virus, develop vaccine, and improve patient management. The pandemic has also exposed disparities in healthcare access and outcomes, particularly among vulnerable populations. It has raised concerns about the long-term impact of the pandemic on global health, the economy, and societal norms. Mathematical and computer modeling has been crucial in understanding and combating the COVID-19 pandemic. These models have been used to predict the spread of the virus, evaluate the impact of public health interventions, assess the social factors impacting the epidemic, analyze medical data, investigate the microorganisms, analyze co-infections, and so on. Modeling approaches have included epidemiological models such as susceptible infected recover to SEER model, that simulate the spread of the virus with the population, statistical models that analyze the association between risk factors and disease outcomes, and machine learning models that can identify patterns in large data sets. Using modeling has allowed researchers to assess the effectiveness of different interventions, such as social distancing and vaccination campaigns, and to estimate the number of cases, hospitalizations, and deaths under different scenarios. Since Russia launched a causeless full-scale war in Ukraine on 24th of February 2022, the country has suffered an unprecedented large-scale tragedy not seen since World War II, and a global humanitarian catastrophe. In the first months of the war, the World Health Organization documented 92 attacks on the Ukrainian healthcare systems, including 78 on medical facilities and 11 on medical transport, causing 73 confirmed deaths and 44 injuries. At the same time, medical personnel and patients alike were targeted. These attacks were carried out using heavy weapons, which have become part of Russia's wartime strategy, causing immense difficulties for medical personnel, while severity impacting the accessibility and availability of medical care in active combat zones and areas temporarily occupied by Russian troops. This has disrupted the continuity of Ukraine's healthcare system, leaving chronically ill patients without access to necessary medication and disrupting the country's COVID-19 vaccination and prevention efforts. Despite recommendations to comply with anti-epidemic measures, the citizens' psychological state due to the war was related the issue of the pandemic into the background. The Russian war in Ukraine has stimulated the forced migration of the Ukrainian citizens, and during the year since the Russia's war escalation, almost 200,000 Ukrainians have arrived in Canada, and a further close to a million applications have been submitted for the temporary residence and the Canada-Ukraine authorization for emergency travel. So the aim of that research was to assess the impact of the Russian war in Ukraine on the COVID-19 epidemic process in Canada. So we propose a methodology which consists of the following steps. The first step is to analyze COVID-19 morbidity and mortality data in Canada. The next step is to build a predictive model of COVID-19 transmission dynamics based on the polynomial regression model. Next one is verification and tuning of the model on cumulative morbidity and mortality data from COVID-19 in Canada from 25th of January till 23rd of February 2022. and to build a retrospective forecast of cumulative morbidity and mortality from COVID-19 in Canada from 24th of February to 25th of March. The last step is to analyze models performance for two different data samples. So we've used polynomial regression, which is a type of regression analysis that models the relationships between an independent variable and one of the more independent variables. I wouldn't describe it in details because it's well-known technique, but I will concentrate more on results we obtained. So the dynamical model for forecasting of the COVID-19 epidemic has been developed using the Python programming language for validation purposes. The model employed cumulative data on morbidity and mortality rates in COVID-19 in Canada from 25th of January to 23rd of February 2022, so for 30 days before the beginning of the full-scale Russian war on Ukraine. We use data sources from the World Health Organization COVID-19 data dashboard. And the figure on the slide presents the results of the retrospective forecast of cumulative new cases of COVID-19 in Canada for that period. And the table shows models accuracy rates for cumulative new cases and deaths of COVID-19 in Canada. As a result of the model performance shows the model has high accuracy, which allows it to be used in public health practice. In order to assess the impact of the Russian war in Ukraine on the dynamics of COVID-19 in Canada, a retrospective forecast of the epidemic process of COVID-19 in Canada was built from 24th of February 2022 till 25th of March 2022, so for the 30 days after the beginning of the full-scale Russian invasion. We used cumulative morbidity and mortality data, and figure on the slide presents the results of retrospective forecast of cumulative new cases of COVID-19 in Canada for that period, and table shows the model accuracy rates for cumulative new cases and deaths in Canada from 21st of February to 25th of March 2022. The retrospective forecast of cumulative novel cases and fatalities due to COVID-19 in Canada demonstrates notable precision and concurrently comparative assessment of mean absolute percentage error. Model reveals minimal variance when applied to data sets 30 days before and 30 days after the beginning of the full-scale Russian war in Ukraine. This includes a consistent trajectory in Canada's epidemic regression. Consequently, it can be inferred that the determinants influencing the COVID-19 dynamics remain unchanged, and the influx of Ukrainian migrants to Canada, as a consequence of the Russian full-scale war in Ukraine, doesn't appear to be a pivotal factor affecting the epidemic course. So this research delineates a systematic approach for evaluating the repercussions of the Russian full-scale invasion of Ukraine on the trajectory of COVID-19 epidemic process in Canada. So the model shows high accuracy both for validated sample from 25th of January till 23rd of February, and for retrospective forecast from 24th of February to 25th of March. The absence of a decrease in forecasting accuracy in the periods after the beginning of the escalation of the Russian war in Ukraine suggests that the forced migration of the Ukrainian population to Canada is not an essential factor that affects the dynamics of the COVID-19 epidemic process. This is due to the peculiarities of the support program for Ukrainians, which restrains large migration flows and allows crossing the border only after a lengthy document check and obtaining permission. Another deterrent is the mandatory medical examination, including COVID-19 infection status for all arrivals of the country. So thank you for your attention.